Welcome back. In a move that shocked many doctors, President Trump and Health Secretary Robert F. Kennedy Jr. this week have announced a link in an increase in autism cases to the use of acetaminophen during pregnancy. Dr. Lurie Gray is an attending physician in developmental and behavioral pediatrics at Lurie Children's Hospital. To join us now with some thoughts on this announcement, Dr. Gray, thank you for being here. First up, we appreciate your time.
It's nice to be here, too.
Okay, so what was your reaction to yesterday's news conference?
Well, I think everybody who cares for kids with autism, like we at Children's, we're very happy that the administration is focusing on these 70,000 kids in Chicago, the 2 million kids and families in the United States. We're very motivated to get scientific information out into the clinical practice to help these kids who struggle with autism and social communication challenges.
There are 70,000 here in Chicagoland, you say. Now, what do you make of the fact that they are drawing this link between increased cases of autism and the use of acetaminophen during pregnancy?
Well, that's a scientific word. Association or link looks at observational studies that look at what mothers do during their pregnancy and the outcomes of children downstream. But it's an association. It's not a causal effect. So these studies help scientists sort of identify factors that they should continue to additionally study to tease out what are the real drivers of the cause and effect relationship for the increased rate in autism, which we currently don't know. But we don't believe it's a link to Tylenol. We believe it's a link to one of the co-founding factors in these studies that is driving the increased rates in autism.
What would be your message to expecting parents with regard to this announcement?
Well, I like to say the highest quality healthcare comes through the highest quality healthcare relationships. So for parents who are pregnant or considering pregnancy, reach out to their trusted healthcare provider, because it's that conversation, it's those relationships that support families as they go through these sort of difficult times, trying to figure out what's the best way to start a family, have a baby, and support that child's development across time.
Having worked with patients that do live with conditions like autism, ADD, ADHD, what has been your experience with regard to the number of cases? Is it a situation where the cases is remaining the same over time, or they're just more well diagnosed these days than they were before?
Well, you've hit the nail right on the head. Our ability to meet children very young, 18 months, 24 months, 3 years of life, and have the diagnostic tools to assess social communication and autism is very different than when I started my career 30 years ago. And so we're now being able to help families get on the right pathway, whether it's with language development or autism or intellectual disability, and support their children as they move forward. So that's very different than when I started my career 30 years ago.
You mentioned that we really need, and in your phrasing during the commercial break we were chatting, we need gold standard studies to go off of here. In your mind, are the two studies that RFK and Trump cited yesterday during their announcement, do those studies meet that gold standard you mentioned?
No, they don't. They're the initial studies that fuel the higher level studies, fuel the experimental studies that lead to our ability to make solid science recommendations that fuel clinical practice. And these studies are the initial studies that are not at that high level of scientific inquiry.
Okay. Last question for you is, do you have any rules of thumb for folks who are having trouble parsing out the difference between an association and causation?
Well, again, reach out to your trusted healthcare provider. Healthcare providers are terribly motivated across the spectrum to support families as they go through these sort of complex medical decisions and information. Fast information on the internet typically doesn't allow families to have a conversation about their feelings, about their worries, that a relationship with a trusted healthcare provider prevents.
Okay, I think that's solid advice. Dr. Lurie Gray from Lurie Children's, we really appreciate your time and expertise this morning, sir. Thank you.
Thank you for having me.